right, we are back at Morning Coffee. I am Jim Cuccinata. It must be Tuesday because I'm here. It is the Halo Health segment. We've got really interesting people here. We have Dr. Bob Haynes and we have Jeffrey Beck. They're from the Family and Psychological Services here in Marlton, as well as I know that you have a bunch of other offices. We'll get to that. One of the interesting things that these guys actually are working every day to help the veterans as they come back from their deployment. And when they become no longer part of active duty, they come for help and they talk to you guys. Welcome.
Thank you.
All right, so we'll start with Dr. Haynes. Right, I'm sorry, Jeff. Doctor
right.
outranks you on this one.
Amen to that.
So tell us what you do.
Well, we have a grant by the Department of Veterans Affairs to meet with veterans afterwards for post-traumatic stress counseling. Not just the recent wars, but I have some that even go back to World War II.
Okay.
Continuing. Predominantly, my population would be Vietnam veterans. A lot of the Iraq and Afghanistan veterans, pretty much Jeffers has been taking
care of.
Taken over, sure.
And then what kind of things are you treating?
Post-traumatic stress and the symptoms associated with post-traumatic stress. We do individual therapy as well as group therapy. Both of us run groups on different parts of the week. And our whole goal is to basically come alongside the VA and basically assist these vets with their post-traumatic stress symptoms.
Excellent. And you're doing it all over South Jersey, correct?
Yeah, we have offices in Marlton. Jeff works out of Vineland as well. Mantua, both of us are in Mantua at one time or another. And we have really 3 other therapists that assist as well.
Fantastic. And how many patients are you treating in a week?
There's at least, I think our last count was 804 a month, so approximately 200 a week.
200 a week. Awesome. And I know obviously everybody's different. Each session lasts a half hour?
No, an hour.
An hour. Everything's an hour session. Great. And if they wanted to contact you guys, how could they find you?
Well, we have a website, and we have phone numbers that they can contact us. We get a lot of our referrals through our veteran service officers throughout South Jersey. And again, they can check out our website. They can give us a call if you need the numbers to that. We can certainly leave those.
You might as well plug them.
856-424-4408.
Fantastic.
That's the number to reach us at.
And you can find us on Facebook.
And Facebook as well. Awesome.
That's right.
And Jeffrey, you brought a special guest with you.
Yeah, that's my little buddy. His name's Potato. I started out with adopting him, but I'm transitioning for him to becoming a full-time therapy dog. He goes with me everywhere I go, and I'm a big proponent in service dogs in general and the powers that a dog has and its ability to help heal.
Right.
And he kind of just helps me in my job.
Fantastic. What does he do? Specifically, is it kind of?
In the meantime, it's mostly emotional support. So
Okay.
I'm getting him to understand basically what emotion is,
Okay.
teaching him what emotion is, and then allowing people who are not best at displaying emotion to really have him assist in pulling it out.
Okay. So he'll be coming into a session and just kind of hangs out and
Yep.
works with your patient.
Well, it's ironic, in the aspect of when you see somebody come in the room,
Right.
their affect is completely depressed. You can see it in their face that something's going on.
Right.
But the moment they make eye contact with him, it all changes.
It changes.
It all goes away. And that in and of itself is special. But when you actually see people who are emotionally distressed and then go to him for their emotional needs, it's really cool to watch because he'll start to pick up on it. He'll lean in on people's laps and again, the complete mood and affect changes.
That's awesome. What got you interested in?
I've been interested in dogs for many years. In the Marine Corps, I was actually a canine handler, so I understood the special need for a dog back in Iraq. But becoming a therapist, I kind of missed that part of me. I had this whole skill that kind of got pushed to the side,
right?
And I wanted to bring it back in. So I wound up looking up service dogs, and I got in touch with this great company called Semper Fido, and now I'm assisting their nonprofit in trying to help veterans get service dogs as well.
Oh, that's awesome.
And then he just kind of fell into my lap, and it's been special on both ends.
Both ends, teaching him to become a therapy
Yep.
dog. That's awesome. I'm here with Dr. Haynes and Jeffrey Beck. They're from Family Psychological Services. We're talking about the great work they do with the vets. One of the interesting things is both of you are veterans.
Yes.
Right? So thank you for your service.
Thank you.
And one of the nice things is you actually are able to talk to your patients and you can actually relate to what they saw and what they do.
I think that's what makes our organization so special. The VA does a great job in treating veterans, but the one thing that I don't know if you'll see is veteran counselors, a full staff of veteran services being served by veteran counselors.
Right.
That's something that you don't see many times, and I think it has a component of not only that relatedness to veterans,
Right.
but also that trust. And in my opinion, trust is the most important thing when it comes to any therapy.
Sure, absolutely.
And we actually cover, from a therapeutic standpoint, we have one therapist who was in the Korean War as well as the Vietnam War.
Yeah.
Okay.
So him being in his now late 80s has seen more than most. So I've actually had someone ask once, he had come in and said, "Are you a veteran?" And by saying yes, he was willing to speak. But we've heard stories about people at the VA that these veterans go into. They meet with them, ask, "Are they vets?" And when that person says no, they really have no interest in speaking.
In speaking with them. Well, absolutely, because it's kind of one of those things where you actually have had to live it to understand it. I am involved with special needs sports, and we always talk about kids, the difference between sympathy, empathy, and compassion.
Yeah.
Right. Well, with you guys in your counseling, right, you have to have all three, but it's really hard to empathize with somebody if you haven't experienced it. And that has to be a huge point of difference for you.
Absolutely.
Yeah, Bob hit the nail on the head. I've tested the theory, actually. I sat there and didn't disclose any of my background and professional. And, the first question I get asked many times, well, are you a veteran? Well, I happen to be a veteran.
Right.
And boom, everything changes.
Were you studying to be a therapist while you were in the Marine Corps? Or
I was getting my bachelor's degree while I was in. And when I got out, I kind of figured out, I wanted to figure out what I was going to do next.
Right.
And, with my own personal issues, as well as that transition to the Marine Corps, I realized that I wanted to be, a therapist,
Okay.
specifically helping veterans. And when I moved to New Jersey, I got in touch with Bob and Family Psychological Services, and it was like the dream job come true.
That's awesome.
It couldn't have fell into place any better than it did.
Any better. That's awesome. And how about you, Dr. Haynes?
It's been about 20 years now.
20 years.
16 year, and right now our caseloads are at the point where it's interesting that we continue to get even Vietnam veterans now, 50 years after Vietnam had started. But it's still, and we notice it's a lot of the same issues. We hear a lot of my spouse told me I need to get help.
Right.
Friends urged me to come. I lost my job because of my anger.
Sure.
And so forth. There's just patterns that we've seen over the years.
Awesome. Actually, when we come back from break, that's going to be a great topic because we can talk about, kind of the signs, how to apply for help, how to get help, and all of that. So I'm Jim Cucinato. I'm here with Dr. Bob Haynes and Jeffrey Beck from Family and Psychological Services, and we'll be back after these messages.
Today's show is sponsored by Hargrove Demolition, your demolition experts. Hargrove is a family-owned and operated business right here in the southern New Jersey area, bringing you 45 years of demolition expertise. Hargrove has all your demolition needs, from emergency demolition service to demolition equipment rental. Hargrove is one of the state-approved recycling facilities right here in the southern New Jersey area. No job is too big or too small for Hargrove Demolition. Contact them today at one of their 3 locations.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to Speed SpeedRaceway.com or just get here now.
When we make Beyond Natural dry dog and cat foods, we start with real meat as the first ingredient. We leave out corn, wheat, and soy. And we own where our dry food is made. 100%. Can other brands say all that? For nutrition you can trust and your pet will enjoy. Does your food go beyond? Learn more at PurinaBeyond.com.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra Innings, where the game never ends.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
All right, welcome back to Morning Coffee. I'm Jim Cucinato. I'm here with Dr. Bob Haynes and Jeffrey Beck from the Family and Psychological Services. And we had a fascinating discussion over break. We were talking about what your website actually is. Did you guys go with short-term memory?
www.fps-nj.org.
.org, good. Or .com.
.com.
You can find it at .com as well, I think. Awesome. So we were talking in the first segment about kind of your military careers, how you both became therapists, how you focus your practices on veterans and veterans only. And we started to talk about kind of the signs of why someone would need your services, right? And you said a lot of times the boss says to you, you know, you need to go talk to somebody. So kind of walk them through how to kind of recognize that they need help, and then also kind of how to find you guys and how that process works.
Well, a lot of times we get people and we ask them basically what brought you here, how did you get here? And some of the more recent, I would say, we've heard from people that said, well, marriage issues. My spouse said, you need to get some help here. And we'll ask them questions, and it's funny how we just see patterns. A lot of times there's patterns.
Right.
People will be anger. Maybe their entire occupational career or their history would include significant amounts of anger, losing jobs, losing marriages. Even substance abuse. There was one study that said that 81% of combat veterans came home and had alcohol or drug problems, especially in the Vietnam realm. Today's veterans come home and there's usually some celebration of their return. Go back to the 60s and there was no celebration of return. There was, you're a baby killer,
right.
You're a murderer, and there was such an outcry against the Vietnam War that we sent people over to Vietnam and drafted them, didn't really give them a choice. And then when they were there, they did whatever was militarily necessary,
right.
Came home to a horrible homecoming.
Sure.
So that's how they started their civilian life now, was basically on the defensive. And that continues for 10, 20, 30 years. The coping skills of drugs, alcohol, anger, or no coping skills of those. And,
sure.
And the next thing you know, they're living a patterned life of divorces and substance abuse, arrests, and so forth.
Sure. Are painkillers a big reason too? If people know if they're addicted to painkillers, it'd be a good time to talk to you guys.
Well, today's veterans that come home and they have physical ailments, the VA often prescribes one of the heavy-duty painkillers.
Right.
And then they give it to them for a short period of time and then say, okay, you're off now. We're not giving you any more. And I think a lot of what you were talking about, the drugs that carry on, I think that leads sometimes to even worse. Or heroin and whatever else that they might be getting into just to numb the pain that the VA doesn't always continue to prescribe.
Continue to prescribe and help them through. And you guys, obviously, you're expert counselors, but you're also kind of a bridge to get people back on their feet. That people don't have to feel like that they have to see you for the rest of your lives. Correct?
Yeah, that's the goal. as nice as it would be to see veterans, all for the rest of their lives,
Right.
that there has to be some end in treatment. But in the aspect of clients, I see two types: clients who are in denial and kind of don't recognize their symptoms,
Right.
and clients who truly want help but don't know where to go, or they have went to the VA and they don't really like their treatment or the direction it's going. So we're kind of a secondary failsafe. But when it comes to symptoms, the average I see common are, the big one is avoidance of family, avoidance of friends, avoidance of places, people, things. Isolation is another big one. And Bob touched on many others. But when it comes to actually coming and getting their treatment, my therapy is a little different than Bob's. We all have our own therapeutic approach.
Sure.
But I try my best to break down therapy between 12 to 18 sessions.
Okay. Excellent.
How about you?
Yeah, pretty much. Another aspect that's very important with what we do is most of our veterans have a claim in the VA for post-traumatic stress.
Okay.
And what we'll do is we'll actually meet with them several times and then produce a report to the VA stating our findings.
Mm-hmm.
And with their claim with the VA, most of the time we have an input into their receiving benefits through the VA.
And is that the first step? So if I'm a veteran and I feel like I have anger issues, or I'm starting to notice that I'm drinking too much, or I'm starting to avoid my family, where do I start to end up with you guys?
Veteran service officers. There's all the counties around us, Burlington, Camden, Gloucester, all have veteran service officers.
Okay.
And these are people that work specifically with veterans, help them file their claims, and it helps the ball roll and get rolling. It starts the process.
Right. And
then,
do you guys have strong relationships with them?
So very much.
Great.
And they'll contact us. We'll get paperwork. We'll get a contract from them,
Mm-hmm.
and they can see us then for a 7-year period.
Okay.
And what's nice is it doesn't cost the veteran anything because it's a grant. We're a nonprofit organization, 501c3 organization, so we get a grant from the VA, from the state Department of Veterans Affairs. So it doesn't cost the veteran anything.
Right. Which is great.
That's very
right.
helpful.
I mean, so it takes away one of the biggest excuses on why you don't need help is you can't afford it. They don't have to worry about that. You guys have that covered.
They don't have to worry about the insurance. They're
Right.
completely covered.
And I know Dr. Haynes from talking to you previously. You're kind of a no narcotic type of person, right? You really try to wean people off and kind of live healthy and natural. Which is
It's
really
a coping skill that is unhealthy. Yeah, when I guess a lot of the medical model of PTSD says if we can medicate that, then we can fix the problems. It's like stapling apples up into a tree. It
Right.
doesn't really make it an apple tree. But if we can fix the root system, then what we can do is naturally affect behavior. It's almost if you squeeze the tube of toothpaste, what comes out is toothpaste, because
Right.
that's what's inside in the first place. So our whole goal then is to squeeze out all the toothpaste and replace it with something more adaptive, and that way the next time that squeeze comes or those stressors start to hit, then something different's going to come out.
Right, to get a different outcome.
Sure.
And one other thing I think that makes Family Psychological Services so unique is the group component. I mean, Bob and I are awesome. Don't get me wrong. But the group therapy that I see here, it's more of a peer-to-peer support, and the ones that other agencies offer is not exactly like ours. And one of the components of PTSD that really impacts someone's life is their social functioning,
Mm-hmm.
their ability to make friends, their ability and desire to want to be around family is really diminished. So having a spot where they can go that has other veterans going through the exact same thing they do is a sense of relatedness that you can't find anywhere.
Right. Do you find that the friendships are built that way?
Immensely.
Great. It's probably, I did not serve, so I'm only going to suppose, but I would imagine that the camaraderie is one of the things that's missed a lot too, is you kind of leave your sense of being in your group and you're thrown back into society.
Very observant, and that's very accurate. The military in of itself, it's like an unknown brotherhood that you can't even talk about. I can't even put it into words.
Right.
Because that's how unique and special it is. And then when we give that back to them, and they all happen to experience post-traumatic stress and traumatic brain injury, you kind of get a sense of that back.
Sure. It's awesome. I'm here with Dr. Bob Haynes and Jeffrey Beck, and we're talking about Family Psychological Services, and how they help the veterans. And you know, the one thing to take away before we go into break is that if you are a veteran or if you have a family member or friend who's a veteran, please have them contact the office. They can help you walk through all of the paths and journeys that you need to take to get help. So with that, we will be back after these messages.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facial, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents.
If you haven't been to Speed Raceway, what are you waiting for? You want to live fast? You want to make every second count? Then grab the family. Round up the guys. Speed Raceway is 100,000 square feet of excitement, whether you're a kid or a kid at heart. Speed Raceway is the place for endless fun all summer long. Log on to speedraceway.com or just get here now.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 856-336-2553.
We are farmers. Bum, ba-dum, bum, 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 bum.
All right, we're back on Morning Coffee. I'm Jim Cucinato. I'm here with Dr. Bob Haynes and with Jeffrey Beck from Family and Psychological Services. We started talking about how Family and Psychological Services is unique because they are a veteran-served, veteran-based nonprofit that helps the veterans kind of get back on their feet from a mental health standpoint, PTSD, post-traumatic brain, and the like. Second segment, we kind of talked about the process. How do you recognize if you need help and where to go for help? The third segment's easy because I don't do anything. Okay, so basically, you're going to take turns. You're going to stare into camera 3 here, and you're going to talk about why people should come see you, how they can find you. Each of you have a joint practice but separate specialties, so we should talk about that. If there's any events that you guys wanted to promote, I know that you guys have an event coming up that you may want to talk about. So I'm going to stay. When I start to fall asleep with Dr. Haynes, I'm going to tell that it's Jeffrey's turn.
Fair enough. Well, what we've done over the years is we've been able to help veterans. We started in 1974, and over the course of the last, I guess, 40-some years, we've met with Vietnam veterans, World War II, Korean, and now the most recent wars. What makes us different is we also have that component, as we spoke of earlier, in working with a claim that a veteran would have with the Department of Veterans Affairs. We're able to advocate when necessary and when warranted if there is a diagnosis of PTSD. We work very closely with the veteran service officers, which is helpful as well because we're all on the same page that way. We're able to correspond back and forth with the VA, and I think that's very helpful. And as Jeff spoke about, the groups are incredibly important because there, as veterans go through their military life, they have a squad mentality, meaning within a squad you have those 4 or 5 people that you're very close to in any war or any combat situation. You have those people that you can trust, and we've been able to earn that trust over the course of the last 40 years. And I think that continues. And actually a lot of our people come by word of mouth. It's not uncommon to see one of our veterans come for their appointment and bring 1 or 2 of their friends with them that they know from the VFW, American Legion, or so forth. And then we direct them back to the service officer, who will then get them a contract to be within our system, and then we work with them. We do have an event coming up on Veterans Day with the Philadelphia 76ers. They play the Indiana Pacers, I believe, and during that game it's going to be very veterans friendly. There'll be different things going on. We'll have a booth there, and you can actually meet us. I know I'll be there, and I believe Jeff will as well. And we'll give you the whole process of how to become part of our agency and how to work with us throughout your entire claim process.
Excellent. How can they contact you again?
Our phone number is 856-424-4408, and the website, and I will get it right this time, is fps-nj.com.
Awesome.
Now, the only thing I'd like to add, and I think Bob can contest this, is the passion that we have. To me, this isn't a job. It's my life. I care about veterans more than anything you can imagine. And something that Bob and I experience in the Marine Corps is a common phrase where you never leave a fellow Marine behind. Obviously, we're not treating just Marines, so it's service members. And just because we're not in the battlefield doesn't mean we can't do it now. So even though we're back in the rear, I still carry that attitude, and I will till the day I die.
Awesome. I really appreciate you guys coming in today. I found this very interesting. It's a huge need in our society to take care of our veterans. There's lots of ways people can help. They can donate. They go to your website, right? They can send a donation. They could mail a donation. They could stop by and hand you guys money on the street. Anything to have a little extra money will go great ways, because I know you guys invest it back into your facilities and help your veterans. So I'm Jim Cucinotta. I was here with Dr. Bob Haynes and Jeffrey Beck, Family and Psychological Services. We will be back next week, but in the meantime, we'll be back with morning coffee after these messages.